Hey everyone, welcome back. If your YouTube channel suddenly feels invisible, it might feel like you're shadowbanned. In this video, I'll explain common YouTube shadowban symptoms and how to spot them step by step in 2026. Step 1, sudden drop in views. If your videos that normally get traffic from suggested or browse suddenly stop receiving impressions, that's a warning sign. Check analytics to reach to impressions to confirm. Step 2, low engagement. Likes, comments, and shares may drop even if subscribers are watching. This can indicate limited exposure in the algorithm. Step 3, reduced visibility in search. Your videos may not appear in YouTube. Search for relevant keywords. Try searching your own titles or topics to see if they show up. Step 4, subscriber notifications not reaching viewers. Subscribers may not get notified about your new uploads. This reduces early traffic, which is crucial for algorithm promotion. Step 5, limited recommendations. YouTube may stop pushing your videos in suggested feeds or on homepages. If browse features and suggested traffic drops significantly, it's a sign of limited reach. Step 6, algorithm testing periods. Sometimes YouTube temporarily tests your channel's performance after changes in uploads, content style, or metadata. This can feel like a shadow ban, but usually resolves after a few days. Step 7, check content guidelines. Videos that repeatedly violate YouTube policies or have sensitive topics may experience reduced reach. Avoid copyright issues, misleading content, and sensitive topics to stay safe. Remember, YouTube rarely shadow bans permanently. Most of these symptoms are temporary, algorithm-related, or due to content guidelines. So if your channel seems hidden, check impressions, engagement, search visibility, and content compliance. Fixing these areas usually restores normal reach within a few days, and that's how to identify YouTube shadow ban symptoms every creator should know in 2026. Like the video, subscribe for more creator tips, and I'll see you in the next one.